Hello, I am doing another video on hormones because in today's challenged world, I am besieged constantly by younger and younger people in their 20s, people in their teens, people in their early teens who never even start and don't have a period, with people who have hormonal issues. First of all, we're going to talk about why the hormones I have and why I did those, okay? And then also, why do you have certain symptoms and how to use them? Now, there's a lot of symptoms. There's a lot of information on the website, and I encourage you to look back at those videos because I try not to be redundant, but I'm sure I am. But let's talk about with stress. And certainly in today's world, why are women getting heavier periods, shorter time between periods, for instance, 21 days instead of 28 days? Why are they getting significant PMS? Why are their breasts getting tender? Why are they getting heavy periods? That's because with stress, if your adrenal glands that sit on top of your kidneys are low, if your thyroid gets secondarily low, and under critical info on the website, they're the symptoms of low adrenal and low thyroid, then your progesterone gets low. That's women. Now, progesterone gets low in men as well. And, for instance, if you have mouth ulcers, men or women, your progesterone is low. Okay, when men get irritable as they get a little bit older, and a lot of times it's not that much older, their progesterone is low. So men need to have their progesterone levels checked as they go down the path of life. They need to have their estradiol levels checked as they go down the path of life. They get higher, it enlarges their prostate. Women need to have their hormone levels checked because if they're toxic and stressed, it impacts the hypothalamus and pituitary in the brain, messes up your hormonal cycles. If your estrogen is high and your progesterone is low, then you start having the PMS, the heavy period, heavy bleeding. Then your iron gets low. Your hair starts to fall out when your iron gets low. Your periods are 21 days instead of 28 days. And then you have the younger ladies who they never start their period till they're 16 or 17 or 18. That's because their thyroid's low, and maybe, depending on how stressed out they are, their adrenal glands are low. Look at the symptoms under critical info. The other thing is, so progesterone. Look, you can be young and have low progesterone. Again, remember, mouth ulcers are always low progesterone. And I use my tooth powder if you have that because it helps get rid of the bacteria. It helps. You can take a little of my organic lavender oil, put it in water, swish it around in your mouth. It helps mouth ulcers. But mouth ulcers are always low progesterone. So the other thing that I have is estriol. So I have progesterone support, estriol support, and DHEA support. Estriol support, virtually no woman needs, no man ever needs, but no woman ever needs until they are getting perimenopausal, menopausal, okay? And estriol support, look, if you have vaginal dryness, your estriol is low. If you have, and it's one of those things when you're menopausal, you have vaginal dryness, you have pain with sex, you just take a little of my estriol support, you put it in your vagina 3 days a week, one pump, use your finger, put it in there, put it on your labia. It moisturizes it. I use my estriol support on the surface of the skin once people get to be like late 40s, and it helps plump up the skin. It helps get rid of wrinkles, plumps up your vagina. That's just skin too. Plumps up your skin. You can mix my estriol support in with my skin products in the morning, and it just plumps up your skin. Then DHEA support. Okay, stress. DHEA comes out of your adrenal glands that sit on top of your kidneys. Now, DHEA normally does not get lower, no matter how stressed you are when you're young. It normally doesn't get lower until you get into your 40s. In the ideal world, I like to have a DHEAS blood level. But if people's skin is really dry, if they're all stressed out, look at the symptoms of low DHEA or low adrenals is what you look at on the website. But DHEA support, I start using in men and in women when they're older. And why do I use a cream? Okay, number one, these hormones are bioidentical. You want to mimic nature. So you want to give your body what it thinks it produced, which is bioidentical. It's the identical chemical form. So your body receives it. It absorbs through your bloodstream. So you put it on the surface of your skin. It absorbs through your bloodstream because you put it on the skin, it absorbs into the skin. And so the cream that it is in is critical. I formulated this cream. Why did I formulate the cream that my hormones are in? Why did I make hormones in the first place? Number one is I found that virtually every non-toxic, every cream, even that compounded drugs are in. People think compounded drugs are healthier. Not usually, okay? Compounded creams, the cream that they drop the drug into and mix it up, okay? Number one, the cream is usually full of inflammatory toxic ingredients. And if inflammation is the cause of all disease and aging, the last thing, and brown spots and enlarged pores and aging and wrinkles and disease of all sorts, the last thing you want to do is spend your money to put inflammatory ingredients on the surface of your skin. So if the cream, it starts out with all these inflammatory ingredients in there, and then the vast majority of creams that are on the market, especially compounded creams, they take more inflammatory ingredients to suspend the drug, even if it's bioidentical, in the cream. So you're doubling and you're making one of the most inflammatory products that exist on the market. I mean, there's more inflammatory products, but this is an inflammatory one, okay? So number one is I knew I had to come up with a cream that was, number one, non-inflammatory, non-toxic. Number two, non-toxic is great, but it's got to absorb. In other words, it's got to pull the drug that's suspended in it through the skin into the bloodstream so that it then absorbs the bioidentical drug. And so your body thinks, aha, I made this because it's bioidentical, not only in the drug that's in it, okay, but it's also bioidentically administered, so the body thinks it makes it. When you take a pill progesterone, never take a pill estradiol because it's a big no-no. It increases your risk of cancer, and nobody should take a pill estradiol. You can take a patch estradiol, but a lot of times those patch estradiols or estriols, okay, two different drugs, the pill estradiol is a big no-no. The patch has all sorts of chemicals in there. A lot of times it irritates the surface of the skin, adhesives, etc., falls off if you get in the shower, stops absorbing, etc. So I do a cream that you put on every day so you know that when you put it on, it absorbs. I formulated this cream. I use this cream every day, okay? And I'm not going to use anything that is increasing my risk of anything. And so So the cream is bioidentical. The cream is non-toxic. The cream we found, and it took us years to make this cream, we found that it absorbed the drug deeper, better, faster, more completely. And how did we find this out? We had patients that came in and they were using other creams and they were using twice the dose. I decreased their dose to what I knew was the right dose using my cream, which was half the dose. And oftentimes I had to decrease it even more. Then I did blood levels, saliva levels, because remember, blood levels are a snapshot of what's going on at that moment when you draw the blood. Saliva levels tell you what's sitting outside the cell. And what we found is that we had to decrease people's levels sometimes 50 to 100% from what they were on. And so then we did studies on that. But so men need progesterone support ultimately. Okay, it helps protect their prostate. Progesterone and estrogen have to be in a ratio in the body. So if your estrogen in women is too high or in men is too high, that puts your prostate at risk. Okay. Now, the other thing I'm a huge fan of on my website is estrogen support. That's a pill. Now, estrogen support is a bit of a confusing name, we've learned, because what it does, if your estrogen is too high in women or in men, estradiol, which is what I call estrogen, estradiol changes to estrone, and estrone is not necessarily good for your breast, and it's not necessarily good for your prostate. So all my people who are on hormones, I follow their estrone levels, but if in everybody, I put them on estrogen support because it gets rid of the estrone. The other thing you can do to help that, eat lots of broccoli, eat lots of green vegetables, garlic, onions. Those are the things that help get rid of the estrone, which is not necessarily good. Now, my estrogen on the website is estriol support. Estriol is down below in the metabolism of estrogen. It's the estrogen of younger women. It doesn't cause any increase in estrone. It's good for plumping up your skin. It's good for plumping up your vagina. As you get older, younger women never need it. Younger women never have lower estrogen. They always have higher estrogen. Younger women always have lower progesterone, especially with stress. The other thing is, the more cat on a hot tin roof you are, the more stressed you are, the more progesterone you need. And if your thyroid's low, your progesterone can be low. And so when people have PMS, they have heavy periods, etc., I often have them start using progesterone support day 14 or day 21 until their period starts. And then sometimes I have them use it during their whole period, because what you're trying to do is decrease the heavy bleeding. You're trying to get rid of the PMS. You're trying to get rid of the breast tenderness, all of which are symptoms of low progesterone. So, DHEA support. So, estriol support, you don't have to worry about estrone. Again, estrogen of young women. It's just plumping things up. And it's step one. And nowadays, there's an epidemic of metabolic syndrome, people who struggle with their weight. Those people, those women produce too much estrogen until they die. And they rarely, if ever, need estradiol, estrogen, as I call it. They often need estriol to prevent the symptoms of low estrogen, and it doesn't cause them to struggle more with their weight, okay? DHEA. DHEA also increases your testosterone, men and women. Look, I see young men now in their 20s who have low testosterone because their thyroid's low or because they're so stressed out. and then they'll also have low progesterone as well. So DHEA support, too much DHEA, you'll get a pimple, you'll get a blackhead, your skin will get oilier, okay? That's one of the things that I tell my patients to follow. I rarely give DHEA support until people are in their 40s, usually mid to later 40s. It's anti-aging, anti-stress, pro-immune system. Very important pro-immune system in today's world. It's going to continue to be forever. And for forever, because that means anti-cancer helps with all of that as well. So you've got to follow your DHEA. You need to follow your progesterone, and it's just progesterone you get the blood test for. DHEA-S is what you get the test for. And then estradiol in men and women is what you get the blood test for. But what's most important is these hormones versus everything else that's on the market, and there's a lot on the market, non-toxic, they absorb the drug deeper, better, faster, more completely. So with one pump, you get a lot more therapy than with the vast majority of everything's on the market, because I have people who are using a lot of things on their skin and they have no symptom relief. It's all about symptom relief. That means the drug's absorbing, it's getting to the cells, which are the factory, which matters. So you sleep better, your inner peace is better, your energy's better, your motivation's better. And women need their testosterone. Some women, their testosterone gets low early. You do free testosterone as the blood test for that you follow. Versus pellets, versus pills. You cannot take pill testosterone. You can only take, with testosterone, you can only do cream for women, okay? And so, and progesterone support, the cream versus the pills. When you take pill progesterone, it's not bioidentical. The body doesn't normally produce and emit progesterone through the gut. And then it has to go through the liver, and it changes the way your body treats it. It's more likely to gain weight. So there's a reason I make the creams that I make. There's a reason that I spent years making a cream that was non-toxic, that absorbs the drug better. And there's a reason that they're on the website. Just like my skin products, they work better, they're stronger, and they're going to give you more symptom relief. Hope that helps. Thank you very much.